In practice of medicine, today we are going to talk about pain and its management. So basically, pain is a very vast and very common term which usually we listen in our clinic. Nowadays, pain is a most common thing that everyone will experience in our day-to-day life. Okay, but some pains are vanished without treatment. Some pain need treatment. Okay, so here today we are going to talk about what are the different types of pain. Okay, first thing, and second thing is that approaching in electrohomeopathy, and third thing, how to treat the pain. So basically, in electrohomeopathy, every disease will come under in equilibrium of lymph and blood. So whenever the disbalance occurs in lymph and blood, you will have any disease. Okay. So basically, this is the concept of electrohomeopathy. So here also, if you observe that if our cells, mostly cells, any types of cells, like we have combination of cell is tissue, we have muscular tissue, we have nervous tissue, okay, we have cardiac tissue, okay, we have nervous tissue, cardiac tissue, muscular tissue, and smooth tissue. So basically, these four tissues are connected with nerves. All are connected with nerves and blood vessels. Three things are connected to each tissue. Okay. So you divide that smooth muscle tissue, cardiac tissue, or skeletal muscle tissue, and nervous tissue. All are connected with nerves, okay, blood vessels, okay, and lymphatic vessels. Okay. So these nerves are peripheral nerves. What we call peripheral nerves. Peripheral nerves may be sensory and motor. Peripheral nerves may be sensory and motor. So here everything is connected with, if you divide four, okay, nerves in nerves, somatic, sensory nerves and motor nerves. Blood vessels which bring the oxygenated blood and took deoxygenated blood, that are veins and arteries we have. Okay, arteries which brings oxygenated blood to the cell, and veins which took deoxygenated blood and metabolic waste from the cells to the heart. Okay, and lymphatic vessels. Lymphatic vessels, these are the mostly in allopathy, in sense of allopathy, we understood. Allopathy means anatomy physiologically. That lymphatic vessels which have to protect the organs from the invaders like pathogens, bacteria, virus, etc., etc. Their duty is there. Okay, so they are the protectors. Nerves, nerves bring sensation. It may be uh, it may be uh, it may be in your hand, like you are going to, whenever you want to do the work like lifting hand, walking, okay, these are the things. And some organs have continuously connection with the brain, but you doesn't feel. Okay, so nerves like that, like heartbeat, respiratory system, okay, like examples. So basically nerves, blood vessels, lymphatic vessels. So if any disturbance occurs in three things, you have one message from the organ. What do you have? You have the message from the organ. Message from the organ. That message, because the organ doesn't have any type of uh, orally it will talk. Okay, so basically it will give sensory message. What organ give? Sensory message. So basically we know that we have five types of sense, like seeing, touching, okay, and hearing. All these are. So in that we have three things are very important, because in that we have one thing is very important, that is sense. Sense, it may be pain, it may be hotness, it may be coldness or cold. So basically, in that organ will have any these three things. This output is coming from the organ in the form of message, is telling that I have any disturbance in the supplying of all these three things. It may be nerves, it may be blood vessels, it may be lymphatic vessels. So how could it will give the message? The tissue, it may be nervous tissue, it may be muscular tissue, it may be cardiac tissue, it may be smooth muscle tissue. Okay, in form of sense. So most common is that is pain sense. Most common is pain sense. Okay. Most common is pain sense. Most common is pain sense. So we have to understand that which thing is disturbed. First thing is that. Second thing is that I am chronology, since I am explaining that. Second thing you have to understood that it may be problem in own tissue. Okay, it may be problem in his own organs, own tissue, own cell. It may be not, there is no problem in the nerves, there is no problem in the blood vessels, there is no problem in lymphatic vessels, but there is a problem in the own nervous tissue, own cardiac tissue, own smooth muscle tissue, okay, own uh, tissue, whatever, four types of tissues we have. Okay, say own problem is there. What are the own problems? We have to understood that. So first thing, supply. Second thing, in his own organs. And the third thing, you have to remember that there is a problem in other organ. There is a problem in other parts of the body. Okay. But it is referring from another place. Okay. The message is referring from another place. Like example, I will give that. There is a kidney stone. How? You know that the kidney stone is coming from the back to the frontal region or pelvic region. Okay. So the pain is referring from the back to the front, from the lumbar region to the pelvic region. So this is the referring pain. But the problem is in another place, but the pain is referring another area. Okay, so this is the third thing you have to remember. First thing, the pain, why the pain is coming? This is the message of an organ due to the problem in the nerves, blood vessels, lymphatic vessels. First thing. Second thing is that there is a problem in his own organ. Third thing, the pain is in another organ, but is referring from that area to another area. So we have to diagnose that. And the fourth thing, that is most least common. First thing is most common, 80 cases that you will get that. And not 80 cases, 60% cases, and 20 to 30% cases in the organ itself. And the 10% is referring pain, and the remaining 5 to 10% is the pathogenic factor. What is that? Pathogenic factor or any disease. Due to the disease, the organ will affect it. Organ, any body part, or anything that is affected. Pathogenic effect. So I'm explaining in simple way that you can remember all those things. The pathogenic factor means the body exposed to any bacteria, virus, or any pathogen, and the bacteria made the damage to the body, and you become healthy after that. But the damaged part of the body is not recovered fully. So the message is coming from that area in the form of pain. This is the fourth one. And the fifth one, very, very important nowadays. Because of this, I think so, there are the number of pains in the body. That is nutritional factor. What is the fifth one? Nutritional factor. Because of the deficiency of nutrition in the body, so it is coming on the blood, because blood is supplying the nutritions. So nutrition is decreased in the body. So you have the deficiency, like calcium deficiency. Because of the calcium, there is, if you're unable to take calcium diet properly, or you are not exposing to the sun properly, so what you will have, vitamin D deficiency, and you have calcium absorption deficiency. Okay. So this is the fifth one, nutrition factor. Okay. So again, I am repeating that the first number is due to the supplying factory. What are the supplying factories we have? Nerves, blood vessels, lymphatic vessels. In the nerves, we have sensory and motor. Basically, we call peripheral nerves. And the second one is we have own organs, own tissue damage. And the third one is we have uh, referring pain. Okay. And the third one is referred pain from that any organ, it is referring to another part. And the fourth one is pathogens. Okay. Like example, I will give that in some cases, what will happen that you have viral attack. Any person have viral attack. He had fever more than 7 to 10 days. Okay. So after that, what happened? The virus affected to the digestive system, mostly to the pancreas. Most of the cases I observed that they have viral attack. Okay. Then what happened after 1 month, 2 months, gradually they are feeling tiredness, and they have urine, most of the passing urine continuously. They have thirst. They want to eat food. So then they tested. So they got that they have the diabetes. Okay. So this is the pathogenic factor which enter into the body, which damage the pancreas. Okay. Then afterwards, they develop diabetic mellitus. Okay. Most of the cases is happening nowadays. Okay. Not only the uh, our lifestyle, but sometimes the virus may be also damaging the body organs. And the fifth one is nutritional factor, very, very important nowadays. And the is also called metabolic diseases nowadays. Nowadays, 60% are metabolic disorders or diseases because of the indigestion, because of the not taking proper diet, like nutritional food, what we our body want. And the last and final thing is the sixth one, which is the reason behind the pain. That is the autoimmune disorders. Okay. In the allopathy, it doesn't have any treatment. Like we have uh, rheumatoid arthritis. This is the one of the disease we can see most commonly in the elder persons. So autoimmune disorders, AID. So in that, if any problem you take, it may be present. It may be from that you will get that is any in this six list. Okay. So these are the approach to the pain, how to approach. Okay. So next, now we'll discuss about till now any doubts or we'll continue.
Yes, sir, continue.
Okay, thank you. Now we'll see different types of pains according to modern medicine. Okay. So basically, pain is very the thing that anyone will approach to the physician easily. Okay. If they feel the pain, they can easily approach to the physician. So we have different types of pain. You can see that this is the uh, characteristic of somatic and neuropathic pain. So we have somatic pain, we have visceral pain, neuropathic pain, and different names are given for the each type of pain in the neuropathic pain. So mostly the neuropathic pain we observe because the pathway uh, is the sensory nerves which absorb which takes the message from the part of the body, like you have any like anyone have a damage, like they fell down. Okay. And they have any wound. Okay. So what we have, they have the sensory nerves. Okay. All organs are connected with the sensory nerves. So what the nerves will take the message from the organ. It have the pathway. Okay. Will not discuss here pathway, but I will show you the image. You can see that this is the pathway, the injury area, and we have the afferent neurons, and it will connect it to the first order neurons, second order neurons, and it is reaching to the thalamus. Okay, and they have different uh, areas. We have the ascending pathway, we have descending pathway. Okay, so for the for the uh, for the pain. Okay, so for the pain, it is the pathway. Okay, it has a track. So basically, the we have the neurotransmitters, because you have to remember that these neurotransmitters are released from that area when you feel the pain. Okay, what are the? We have uh, serotonin. One is serotonin. This is the thing you have to remember. Serotonin and non-epinephrine and several neuropeptides as neurotransmitters. So these are the neurotransmitters. The neurotransmitters are released very drastically when you feel the when you have to feel the pain, because you have to reach the thalamic area, and you have to concentrate morely on the injury part to heal the part. So that's the reason the neurotransmitters are continuously traveling from the brain to the part, from part to the brain. It is continuously traveling. So let's discuss about different types of pain. What are the names we have here? We have the name is neuralgia. What is the neuralgia? Neuralgia means it is the problem in the single nerve. Like you have the trigeminal nerve or trigeminal neuralgia. Okay. And we have this dysesthesia. Dysesthesia. It is the abnormal sensation continuously You have the some you are feeling some pain here is there. You have the pain in the neck continuously, but it is not disturbing you. It is not force you to go to the physician. You are feeling some pain. This is a this dysesthesia. And we have the hyperalgesia or hyperesthesia. It is the exaggerated response. So whenever you touch, you have the pain. Touch respectively. So whenever you touch, you have the pain. So this is very dangerous pain. Okay. And next is allodynia. Okay. When you are giving stimuli, then only you are feeling the pain, not only touching. Okay, this is the one of the type of pain you have this, and we have the hyperalgesia. Hyperalgesia means you are feeling the pain sensation. Okay, whenever you have mechanical work, like you are walking, lifting the hand, you are moving the fingers, then only you are feeling the pain. Okay, and we have analgesia. Analgesia means absence of pain. Okay, and pausalgia. Pausalgia means the pain with burning sensation. Pain with burning sensation. In that we have sweating, okay, and vascular inflammation. You can see that in that condition. Okay, so this is the different types of pain. When you touch when you touch, you have severe pain. When you have mechanical work, you have the pain. Okay, when you are lifting, or this is mechanical only. And okay, and different types of pain. You have the pain, but this is the unpleasant. Doesn't want to go to the physician at that condition. Okay, so these are the different types of neuropathic pain. Okay, so the pain approach to the pain explain. We have the different types of pain here. And so first, the this is the thing we have to remember, what type of pain is feeling by the patient. Okay. Next, we have the what types of treatment in allopathy they are taking. Mostly, they will use NSAID, that is non-steroid anti-inflammatory drugs like diclofenac, aceclofenac. Okay, first line of treatment is that. Next is narcotic analgesic, like we have tramadol. But we are kindly remember this. This is not for electrohomeopathy doctors. They are using this for knowledge. I am sharing that. Okay, not for using. Okay, please remember this. You have to consult the physician of allopathy, not electrohomeopathy. Okay. And we have the different types of anti-convulsion or anti-arrhythmic neuropathic pain medicines. Okay, you can see that this is the box given here. We have non-narcotic drugs. This is mostly NSAID, and we have the narcotic drugs. Okay, and antidepressive, anti-convulsant. So these are the four types of treatment is there in the allopathy. Okay, nowadays I think so there are different types of drugs available. So I don't know about that. Okay, I hope you understood about this. Now we will how to treat in electrohomeopathy. So this is very important to us. I already told that we have to know that in that four types, what is the main thing for reason, for cause we are treating. Okay, if there is a problem in all this, if it's a problem in the nerves, we have to treat according to the nerve remedy. If it's a problem in blood vessels, we have to treat according to the blood vessel remedy. If any problem in the lymphatic, okay, lymphatic remedy, lymphatic vessels, we have to treat according to that. If any problem in the own organ, we have to treat that organ. Okay, if I had a referred pain, we have to know that what type of from where the pain is referred. So for that, we want to know that we need the scanning, X-rays. It may be required. Okay, and fourth is pathogenic factor. So you have to take the history of the patient from from how many days you are ill. Take from past 3 months to 4 months history. You have note down that, and you have to uh, You have to approach to the roots of the disease, okay, cause of the disease. And fifth one is mostly nowadays metabolic and nutritional factors are there. So you have to treat like that. And autoimmune disorders. So you have to treat that. So basically, if any emergency condition, the patient came to a clinic, if it is neuropathic pain, whatever we discussed, so how to treat that? So I have the three phases of treatment. I will explain you. Phase one, if it is pain is mild. So you have to treat with this treatment along with the cause. Then only the permanent pain will relieve. If you give this treatment, the pain will decrease, but for not longer time. It will become 15 days or 20 days or 2 week or 1 week. In the phase one, we have the three remedies. What is that? Like in the allopathy, we have four stages. First is they will give NSAID, okay, narcotic drugs, narcotic analgesis, and we have the anticonvulsive drugs. Okay. And fifth one is anti-depressive drugs. So they have the phases. They will not give directly antidepressive drugs. First, they will NSAID. If it decrease, okay, no, don't worry. You doesn't need all these drugs. Narcotic drugs under the physician, neurophysician, general physician, MD physician, they will advise, or psychiatrist. Antidepressive, they will also this is by the physician itself, psychiatric. Okay, convergent, this is also by the neurophysician or other physician, whoever think it is better for the patient. So likewise, we are designing the treatment. In the phase one, like NSAID, what we have the which decrease the inflammation and as well as pain to the body. So in the if it is nerve pain, we have F1W. It is very, very good. Neuropathic pain, all types of neuropathic pain. Okay, it you have to give in D6. So please remember, in any case, it is not only for pain, if in any treatment, the disease in hyperactive, so you have to give the remedy till the disease will become not normal, become constant. Okay, like here pain, cause you are not treating now, you are treating only the pain, F1W. Now you are taking the D6 directly on the tongue according to the condition, or else in the required amount of water. Okay, this is the best F1W in the phase one, mild pain. Okay, and second is in that we have three remedies only. F2W for external application. This is in D4 or D6. In the third condition, in the third, we have the C17, D6 to maintain the pH balance in the body. Okay, this is the mild phase one treatment. And the moderate type of pain. Okay, so we have F1 again. Here we will add S1W again in D6. Okay. Next is again F2. Which part of the body is affected? You have to select that electricity. If right side is affected, you have to take RE. If left side is affected, you have to take YE along with WER2. So here we are adding right side, left side remedy along with WER2 application. Okay, again, third remedy is that we have again we are taking F1, A3, C5 and RE in D5. This is the best pain. So, okay, this is the second phase, that is moderate in moderate. Why here? Here we are the S1. So it is not only work as a neuropathy, NSAID, but also works as a narrow necrotic. Okay, it's also work as narcotic. Means it is not a narcotic drug, but it's work like that. Okay, brain from the brain it also start. And we have, if it is sometimes it happens, we have the inflammation. So here fourth drug also you can think that as C17, F1 and Y. You can use this remedy also in D6. Okay, so these are the moderate pain remedies. Next, we have the severe pain remedies, which is very difficult to, you need more experience, but according to the your OPBs, you have to give this remedies. Next, we have the F1, A3 here, S1, L1, W. All this in our D6 or D5. Mostly D5 you can use. Okay, because severe pain you can see in D6. Sorry, D6 you have to give. Next, you have the application, same F2, RE or YE. Okay, and along with word 2, along with here we can add angioticus. If it is right side, A2, or left side, A1. This is in D4, D6. This is D6. Only D6 we will use in severe pain. F2, REYA or word 2, and word 2, A2 or A1 in D6. Next, we have the only and after that we have the remedy, that's again C17, F1, Ver1 by. Okay, here we will give Ver1 by. Okay, so you have to use in directly, continuously you have to use that remedy. And the last remedy, that is nothing but as a uh, allopathy, will match with allopathy. Already we added S1 L1 here, WE here, F1 A3 here. If the pain is not controlled by this remedy, mostly it will control. Okay, in severe condition, again you have to apply F2 WE on top of the head, F2 WE in D6. Okay, okay, it is work as same anti-convulsive and antidepressive. Okay, so this is how you manage the pain, and this is how to approach the pain. This is how you know the different types of pain. Okay, so this is all for us. Phase 1, phase 2, phase 3. Okay, if anyone have any doubts, kindly ask. Okay.